Hello, and welcome back to the Living Well podcast by Jefferson Health. I'm Carly Williams.
And I'm Jess Lopez.
Welcome to part 3 of our mini-series on how stress affects the body. Our final episode in this series is all about stress and how it impacts gut health. In case you missed it, part 1 details how stress affects your heart, and part 2 delves into how stress impacts nervous system regulation.
We'll have links to both episodes in our show notes. In this episode, we connect with Gastroenterologist Dr. Cuckoo Choudhary. She discusses the impact of stress on the digestive system, from gastrointestinal motility to the GI conditions that stress can exacerbate or even trigger.
We'll also talk about gut health and ways you can support it, even through times of stress. It's an information-packed interview, so prepare to take some notes. Here's our conversation with Dr. Choudhary.
My name is Cuckoo Choudhary, and I'm the Dorrance H. Hamilton Professor of Medicine in the Division of Gastroenterology and Hepatology at the Sidney Kimmel Medical College of Thomas Jefferson University. I practice general gastroenterology, but I have an interest in inflammatory bowel diseases, which means ulcerative colitis and Crohn's disease, irritable bowel syndrome, and other diseases of the GI tract that affect women more commonly than men.
Thank you, Dr. Choudhary. And what are the ways stress impacts the normal functioning of the digestive system?
Stress, as you know, can affect us at any point in our lives, and it can be due to external factors or from factors within us. And no matter what the cause, stress does have an effect on the normal functioning. It can alter the gastrointestinal motility, which means the ability of the small bowel and the colon to squeeze and move forward the undigested food and waste products. Stress can also increase what we call visceral perception. That means the gut becomes more sensitive to pain and to extraneous stimuli. So these patients can sometimes have abdominal pain. Stress can also increase the sensitivity of the GI tract. It can cause a change in the gastrointestinal secretions, thereby sometimes causing diarrhea. It can lead to increased permeability, which is often referred to as the leaky gut. And the other negative effects are that it can affect the mucosal blood flow of the GI tract and also have negative effect on the intestinal microbes, which are the bacteria that reside in our gut.
And when you mention some of those symptoms, are there some that come up more chronically with acute stress versus long-term stressors?
Yes, with acute stress, you can get things like upset stomach, diarrhea, feeling that you're having heartburn, which is like reflux and acid coming up of your mouth, abdominal pain, especially lower belly pain. Some people even get nauseous and vomit. With more chronic stress, what you can have is diarrhea. That can definitely happen. You can also have some chronic diseases like IBS that often has a flare-up with stress, or one can have exacerbation of IBD like ulcerative colitis or Crohn's disease, or even bloating. So stress can cause both long-term effects on the GI tract and short-term as well.
And when we're talking about stress, how is stress best defined?
Very interesting that you asked that question. There are so many definitions of stress, but one of the definitions that I think World Health Organization put out at one point was that stress is a state of worry or mental tension caused by a difficult situation. So it sounds very easy. And stress is a natural response that prompts us to address the challenges and threats in our life. And it's not always bad. And all of us, everyone expresses stress to some degree. But as we all know, the way we respond to stress makes a big difference on our overall, what we refer to as the well-being.
And is there a difference between physical stress you could be putting your body through versus emotional stress and how your digestive system would respond, or are they the same?
Whether you have or one has physical stress or mental stress or emotional stress, it really does not matter that much as to how the GI tract responds. It more matters whether any of that stress is temporary or is it more permanent or recurring.
Mm-hmm.
You sort of mentioned the specific GI disorders and symptoms that are associated with stress. When is a good time to see a healthcare provider in those circumstances?
Yeah, that's a very good question. If the person knows that there was a stressful event and say they had a symptom for a very short period of time that has recovered completely, and they had never had that before, I think it's okay not to go to the doctor. But if they had repeated symptoms, even if they know that that was precipitated or if by a stressful event, they must see the doctor because there is always a chance there is something else going on. And then there's always a chance that the doctor can help them cope with the stressful environment. I would say that anytime you feel that things are not quite right, it may not be bad to seek healthcare.
And just to clarify, when you talked about stress escalating or aggravating symptoms with the chronic GI disorders like ulcerative colitis or IBS, it's not that stress could cause these GI disorders, or could the cause for the GI disorder actually be stress itself?
Very interesting. So let me tell you specifically about IBD for that matter, which
Mm,
is ulcerative colitis and Crohn's disease. We are learning a lot about these diseases, and we have learned quite a bit in the last 2 decades, and there's a lot more that will be learned in the future. But what happens is, it is possible that stress causes the onset of ulcerative colitis. What the book tells us is that there is a genetic predisposition to these conditions, and when that genetic predisposition meets the right environmental trigger, IBD sets in. Now, that environmental trigger could be a bacterial infection in the gut. That environmental trigger could be a very stressful period in the life of a person. And I have patients who come in with these diagnoses, and whether we believe it or not, they do say that there was a stressful period in their life. I recently had a patient whose daughter was in the ICU for quite some time. She was fine before that. With a few months stay in the ICU, somewhere down the line, symptoms of ulcerative colitis set in. So, to answer your question, yes, if the right genetically predisposed person meets the right environmental trigger, which could be stress, these diseases could begin.
that's interesting. Super powerful. Another hot topic on our blog is about the gut's microbiome. So we were wondering specifically about how stress can affect the gut's microbiome and its role in digestive and immune function.
There has been so much said about the microbes in the last few years, and there is so much more that we don't know. But let's begin by saying that there are about 100 trillion bacteria that reside in our gut. How does stress affect the gut microbe? Let me begin by saying that, first of all, stress encourages people to eat foods that are highly palatable, right? That taste well.
Facts.
The cookies, the cakes, all of that. And the bad gut bacteria thrive in that. So if one were to eat these foods under the time of stress, what does it do? It leads to overproduction of this not so good gut bacteria, which is not good for us. Also, stress can increase the permeability of the lining of the GI tract, therefore resulting in a leaky gut. So these bacteria can then seep into circulation, and then once they seep, they create an inflammatory response. Once they create an inflammatory response, there's inflammation and symptoms of abdominal pain and diarrhea can occur. And this inflammatory response is more likely to occur by the not so good bacteria of the gut. There was a very interesting study that caught my attention. I was reading it about a month ago, in which a study was done on university students. And what they found is, as the semester progressed and the stress of these students increased, the amount of bad bacteria in the gut increased. And that is often referred to as dysbiosis, which means an imbalance between the bad and the good bacteria, the bad bacteria being more than good. We know that gut bacteria regulate the immune system, but if you have the bad bacteria, then that is more likely to cause autoimmune conditions and can increase the risk of infection.
So, our diet is a big predictor of what our gut bacteria look like.
Diet is a very important predictor of what my gut bacteria is going to look like because diet determines which bacteria will thrive in my gut. It's very interesting that our diet in the United States, which is high in saturated fat, processed foods, refined sugars, etc., there's a very low diversity of the gut microbes. And this leads to what is called the metabolic syndrome, often leading to weight gain, even obesity, and other chronic diseases.
Mhm. Because, of course, you can buy prebiotics and probiotics in a pill form. Is that something that you think is beneficial for people to buy to supplement a diet that maybe not be the most diverse when it comes to fiber or vegetables and fruits? Or do you think whole food is the best way to get those pre and probiotics?
So I'll tell you, yes, it is always better if you can eat the whole grains and the vegetables and the cruciferous vegetables to get the prebiotics in your diet, definitely, because they have other things that a pill cannot have.
Mm-hmm.
But sometimes when the patient tells me, for instance, that they cannot tolerate dairy or they don't like the texture of the yogurt, then I have them buy the probiotic pill.
Got it. So it sounds like a good discussion point to bring to your doctor.
Absolutely,
Mm.
absolutely. As I tell them or as I suggest to them that they should have probiotics, I always ask by saying, will you eat yogurt if I asked you to eat it 5 days a week? And if I see that they are not quite sure, then I tell them, okay, if you can't, then let's supplement it with the probiotics.
When you are suggesting people eat yogurt 5 times a week, is that something where it's like have it for breakfast every day, or you have a couple tablespoons of yogurt and that can satisfy the amount that you should have daily?
No, if you really talk purely from a science standpoint, I don't think there have been studies done to say, all right, this amount of yogurt is needed. But
Hmm.
I think 1 or 2 tablespoonful to me sounds really small. So I have them eat something which I think is convenient for them too, an 8-ounce cup of yogurt or 6-ounce cup. I usually have them eat it at breakfast or lunch time, not during evening, because some people that have acid reflux don't do very well if they eat sour stuff towards the end of the day.
And are you Greek yogurt fan? Any kind of yogurt?
Any kind of yogurt.
Okay. And should we be worried about the sugar content in yogurt, or do you think that it balances out?
Sure, if you're eating a lot of sugary stuff, or if one is a diabetic, you have to worry. And as you know, there are sugar-free yogurt. I also encourage people to make yogurt at home. It's not very difficult. It's not difficult at all. And that can be sugar-free. Or I have them buy the plain vanilla or just the plain yogurt, which does not have sugar, and add fruits to them. So
Mm.
it all depends upon how much sugar one is eating overall. If that 8-ounce cup is the only sugar or almost the only sugar during a 24-hour period in a non-diabetic, I think that's okay.
Hot take.
Yeah. And I'm also curious, does it matter if it's whole milk or skim, fat free?
Yeah, no, it does not matter as far as the probiotic is concerned. Obviously, if one is trying to watch weight or calories, then whole milk yogurt is not desirable. But any kind of yogurt will have probiotics in them.
For people who typically aren't eating a lot of whole foods and fiber, I know when you start introducing those things, your gut can kind of feel upset because it's not used to processing things like that. Do you have advice for people who maybe are experiencing gastrointestinal discomfort when they start trying to eat healthier to not throw your hands up and be like, you know what? McDonald's doesn't hurt my stomach, so I'm going to go back to eating McDonald's.
Yeah, excellent question. Very important. Yes, you are right. It is true that when you start introducing fiber in your diet, especially if one is not used to it, you might feel uncomfortable. And what that they feel is they feel a little bloated. And that's not surprising because fiber is not soluble. You put some water to it, add to it, it swells up. So I have them start with a small quantity of fiber.
Mm.
And I also have them drink a big cup of water when they eat the fiber containing food so that there's enough water there. Start slow If I have them take a supplemental fiber, or like a fiber wafer or a fiber pill, then I have them do the minimum dose and I tell them do it for a good 2 weeks. If you're feeling okay, increase the dose. So go slow, start low, go slow.
What other foods do you recommend to patients for good gut health?
Some of the other fermented foods, if people like kefir, foods that are colored like your peppers, your green peppers, your red peppers, your artichokes, those are really healthy for one's gut. Plant-based foods are any day better. As one of my teachers had told me once, if the food on your plate does not look anything like from what it was prepared, that means there is a problem. Meaning, if you can identify that pepper, there's some red and green on the plate, I think that's good.
And what are some of the best ways to protect your GI tract during times of stress?
Eating healthy, small meals frequently instead of eating a large meal because that can make one get bloated and frustrated. Exercise, especially the mindfulness breathing exercises. Try to reduce the caffeine. Totally opposite of most of us do. The more stressed you are, the more caffeine intake, but that should be reduced. Probiotics and yogurt, as I said, start with small changes and then make sure that your bowel movements are regular, that one is not on the constipated side, that you don't feel bloated. Some of the signs that your gut is healthy is if you're moving your bowels regularly, if you don't feel bloated, and if you don't have a feeling of indigestion. So exercise, high fiber diet that is rich in complex carbohydrates, low processed foods, low sugar, low fat, and moderate protein.
And how would hydration play into that as well?
Yes, drinking 6 to 8 glasses of water per day, as is recommended, is extremely important. Hydration does decrease fatigue, and it definitely makes one feel overall better. So, yes, that is another thing that is very important during times of stress and even otherwise.
And what about some of the best ways to alleviate any symptoms that come up? Is it okay to be taking a medication for diarrhea? What are some of the different ways you could help your body?
Another very good question. So, once a person knows their diagnosis, say they have been told by the doctor that they have irritable bowel syndrome, that is diarrhea predominant or that fluctuates between diarrhea and constipation, and the doctor is, it is okay to take Imodium. Because as I tell my patients, there are two aspects of treating anybody. One is you treat the illness that they have, but other thing is you have to treat the person. They have to live a life. So it is okay if they have a long trip to make, it's okay to take a tablet of Imodium that morning before that. That's absolutely fine as long as you have been seen by your physician and you know what the diagnosis is.
That is a good reminder to check in with your physician before self-diagnosing. I'm curious, Dr. Choudhary, how do you manage stress in your own personal life?
Off the record? Okay. All right, on the record. The one important thing to manage stress and gut health while you're stressed is when you sit down to eat, make sure you give that adequate time. Let the stomach digest the food. This is something that we don't know, and I'm guilty of this too. You're trying to eat while you're answering a patient phone call. Somebody is knocking on your door to give you a message. So that's not the best thing for the gut. So giving yourself adequate time to eat. How do I manage stress? I like to read a lot of books. At any time, you'll find me reading a book for sure. So reading books, going for walks, and drinking plenty of water.
Chewing is super important too, right? And we can inhale food if we're nervous or just trying to get through a meal. Can you talk a little bit about how important actually chewing your food is?
You're 100% correct. So chewing food, something that is really underestimated in these days of being very efficient at work, is very important. Now, why is chewing important? It gives you the chance to enjoy food. You know what you're eating. You're actually enjoying food. That's number one. Number two, it gives your brain time to realize that you are feeling full. So if you chew the food slowly and eat slowly, you are less likely to overeat. because you're going to feel full quicker. So it satisfied your satiety center. So that's important. The third is when you chew the food into the fine, small pieces, it's easier for your stomach to mix and it's easier for the small intestines to digest that food.
Are there any other important considerations when it comes to measuring your own gut health?
So avoiding constipation is another very important thing in trying to maintain gut health. And people should know that constipation doesn't just mean that you have not moved your bowels for days. One can move their bowels every day and be constipated. And how can that happen? If someone is moving their bowels every day and are having hard pellet-like stools, or one big piece of dry, hard stool that they're having difficulty pushing, that's constipation. And that shows that the gut mobility or motility has been altered, which means the ability to move the digested products through the gut, which means that there is something that needs to be done for that.
Can you talk about how constipation can be treated?
That could be giving a safe drug for chronic constipation. There could be the doctor talking to them, asking them to alter their diet. So it is very important. And not every constipation can be treated by a high fiber diet. There is no doubt that diet is important, but there are people who have a high fiber diet and are still constipated. Why? Because their colons intrinsically do not move very well. Something that is called slow transit constipation or a lazy colon or colonic inertia. And these group of people need medications because once they start to move their bowels, they will not feel bloated and they'll feel well.
I didn't realize there were different types of constipation. There are so many different medication options you can buy over the counter, but it seems that maybe that's not always the best treatment option.
You're absolutely right. On average, when a person sees us for constipation at Jefferson, they have already gone through many over-the-counter medications for constipation. I don't blame them because for every constipation episode, they obviously cannot come running to the GI doctor. But just so that you know, if they have not responded, it's always good to get an appointment. Sit that one time with your GI doctor, discuss what your constipation is. They'll be able to diagnose exactly what kind of constipation you have. There are different kinds of constipation. Not every constipation is same. If they think you need fiber, great. If they think you need water and exercise, wonderful. If you're already doing those things and you are still constipated, then the problem may be in your colonic motility and they might recommend medications. So I think it is important that if you have tried some over-the-counter drugs and have not had adequate response, please see your doctor.
Be sure to check the show notes for additional resources, including the link to the Living Well blog where we publish full episode transcripts.
And if our conversation with Dr. Choudhary sparks your interest about gut health, check out our show notes for a link to our episode with Dr. David Kastenberg, who talks about how to cultivate a healthy gut microbiome and everything you need to know about colonoscopies.
And as always, if you enjoy our podcast, we truly appreciate a rating on Apple, Spotify, or wherever you listen to podcasts. Fun fact, the full podcast episodes are also available on our YouTube channel at Jefferson Health.
Production support for today's episode provided by Brittany Rafalak and Barbara Henderson. We're your hosts, Carly Williams
and Jess Lopez. Be well.